Well, good evening, and thanks to all of you for joining. My name is Dr. Reed Tuckson. I am a co-founder of the Black Coalition Against COVID, and we really want to welcome every member of our audience to this very important town hall on COVID. That's right, COVID is still with us. It is still serious, and as you will hear today, there is important information that we need to have to protect the lives of ourselves, of our family, and to protect the communities in which we live and work. We are here with the top leadership of health officials of our federal government, as well as an unprecedented and incredible collection of Black organization leadership. We have really come together. And as we will learn and see in this show, when we had the experience of the pandemic recently behind us, that the African American community's mobilization was extraordinary. We did better than any community in this country. And as a result, our life expectancy as a result of this suffered less than almost any other population. And certainly more, we've saved more lives in the Black community than even our counterparts in the white community. So we know that when we come together as a people to save our lives, we can be successful. To start us off and to welcome us, let me turn to my friend, Dr. Willis Lanzaire, Chair of the Council of Presidents of the National Pan-Hellenic Council. Willis?
Thank you, Dr. Tuckson. I'll say to you that I am the General President of Alpha Phi Alpha Fraternity Incorporated, and I do have the pleasure of serving as the Chairman of the Council of Presidents for the National Pan-Hellenic Council, or more fondly known as the Divine Nine. We are an amalgam of many members. Really, our aggregate influence is about 2.5 million, and our extended reach is really about 7 million people. But we also recognize that some of us are very integrally related in the community. And we want to make sure that we are doing our part as a council. I'm trained as a biomedical scientist myself, but the leadership within the Divine Nine has always been about advancing our knowledge and standing up in the community and making sure that they take COVID seriously. So that's why we're here. And I thank you for the opportunity, Reed, to be with you tonight. And let's get it done.
Well, thank you so much, President Lanzaire. And now my friend Mary E.N. Clark, who is the Vice President for Programs, to welcome us on behalf of the Black Women's Agenda.
Good evening, everyone. I am Mary Clark, Vice President of Programs, Black Women's Agenda. It is my honor to greet you tonight on behalf of our President, Guinevere Catchings Hess. The Black Women's Agenda is honored to be a part of this important town hall, and we applaud Dr. Tuckson and the Black Coalition Against COVID for organizing another critical and necessary conversation about COVID and other illnesses that are on the rise in our community in 2024. I want to acknowledge the 24 BWA National Collaborating Organizations who joined us again this year in supporting this event tonight. Through our collective efforts, we were able to spread the word about the town hall to millions of Black women of all ages and their families. I hope that by the end of this town hall tonight, you and I will have learned at least 3 things that we didn't know about COVID in the Black community. Thank you very much.
Well, thank you, Mary Clark, and I'll take to heart that we will make sure that we'll do everything in our power to make sure that people remember at least 3. I'm going for 5. Now it's my pleasure to welcome Virginia Harris, the National President of the National Coalition of 100 Black Women Incorporated. Virginia Harris.
Thank you, Dr. Tuckson. The National Coalition of 100 Black Women, established in 1981 in New York City, stand as a 43-year-old advocacy organization with the mission envisioning a future where socioeconomic disparity no longer burden Black women and girls. With 63 chapters across the country, boasting over 3,800 members, NCBW serves as a potent voice advocating for the right and interests of countless Black women and girls across the United States. As a member of the National Coalition of 100 Black Women, we understand the importance of empowering our community with accurate information and scientific evidence to make informed health decisions. By joining forces with other Black community leadership organizations, we aim to provide the necessary facts and evidence that enable individuals to make personal, appropriate health choices for themselves and their families. In a landscape where misinformation can be rampant, our collective effort ensures access to reliable resources and support systems that prioritize the well-being and health equity in our community. Thank you so much for the opportunity to join the conversation this evening.
Well, thank you, President Harris. And I think you put your finger right on the pulse of what we're all about here, is giving people the factual information they need to make personally appropriate choices. As our Black health professionals come together with our fraternal and social organizations, of course, to bring it all together, there has to be our faith-based partners and brothers and sisters. Deborah Fraser Howes is the founder and the board chair of the faith-based health initiative called Choose Healthy Life. Deborah?
Hi, Reed, and thank you so much for having me. You know, I learned a lot about the utility of the Black church in public health crisis during the AIDS epidemic when I founded the National Black Leadership Commission on AIDS and had ministers get tested and combat misinformation from their pulpits. So Choose Healthy Life was born out of a legacy. It was not a new idea. And its unique role is very important. We're spreading awareness, we're curbing misinformation, and we're connecting people to vaccines and care through Black church public health navigators. These are men and women on the ground, raised up in their respective faith communities, who are out there standing in the breach between the epidemic and the community. We have hosted over 4,000 events in 120 churches across 13 states. We've administered and distributed over 200,000 COVID-19 vaccines and 75,000 test kits. We continue to deliver these services and encourage our communities to get vaccinated and address the health challenges that they have that are underlining and what's killing them. One thing I want to say, you know, they used to say, you know, when white America gets a cold, Black America catches pneumonia. There's a reason for that. And one of the reasons is that we've not been able to stabilize our infrastructures that we know that work. So I am hopeful today, as an advocate for the community, and with your help, that we find a way to address some of these things. And thank you so much for having me. It's an honor.
Thank you so much, Deborah. We also want to thank, as we start the show, our sponsors who have given us generous educational grants. And we want to thank Moderna, Novavax, and Pfizer for their support. As we go forward now into the heart of the show, we're going to cover a lot of ground. We're going to cover it pretty fast. I would urge you, if you have a pen and paper handy or something to jot some notes down, you might want to keep that handy because we're going to move very rapidly. Or in the chat, you may also put your questions that you may have, and we'll try to address those as we go along. But also, our federal officials have asked for a special request, and that is this. They want to get from you information and ideas and suggestions of how we can improve our performance as we get ready for the next year's flu, COVID, and RSV season, the respiratory season for next year. They want to get it better. And so if you have suggestions, please feel free to put those in the chat and we will get them to us. But to kick off this show tonight, we're very pleased to welcome Major General Paul Friedrichs. Paul is a physician who serves as the Deputy Assistant to the President of the United States and Director of the White House Office of Pandemic Preparedness and Response Policy. Welcome, Dr. Friedrichs. And maybe we can start off with trying to understand your role there, your office, because it's pretty new and most of us don't know exactly what it entails.
So, Dr. Tuckson, thank you very much. And thanks to everybody who's on the line this evening. Before I talk a little bit about the office, I just want to extend my personal thanks to all of you. As we have stood up this Office of Pandemic Preparedness and Response, we've looked at what the best practices were over the last 4 years of the current pandemic. And it is clear that one of the greatest success stories was our ability to reach out to communities in which we had key leaders who were willing to engage with us and to help spread the information that we had across the communities that they routinely worked with. Our Office of Pandemic Preparedness and Response was stood up by Congress. It's actually very unusual in that Congress directed the president to create this office to work across departments and agencies and to leverage the best practices of the pandemic and make sure that we are better prepared for future biological events. And as we stood up the office last year and started looking at what those best practices were, one of them that immediately stood out was the work that you, Dr. Tuckson, and your colleagues have done in reaching out to communities that historically have not been well represented in the outreach. Excuse me, I've got a little bit of a cold. The outreach that we have historically done from the federal government. And so as we looked at our priorities for this new office, by law, we're directed to find the best practices, the things that really worked well. And one of the first people that I reached out to was you, because I heard from so many people how important that connection was and how valuable your ability was through your colleagues to reach out to a group of Americans who will benefit from the information that we're collecting about how best to protect themselves, either from COVID or from future diseases. And to answer your more specific question about what our office does, in a nutshell, we're the conveners, we're the integrators, we're the ones who help pull together all of those key leaders across the country who are willing to help us respond to future biologic events. Congress designed this office, and President Biden and Vice President Harris have supported the office in standing up in that role as a convener and an integrator and a synchronizer. So again, thanks to you and thanks to everybody who's on the line, because we think that this is exactly the sort of work we need to do.
Well, thank you so much. When you called me to express your concerns, you got me motivated. Share with our audience, because I think a lot of people think COVID is over, that people are not dying or suffering from it. Why do you think it is so important that we address this issue tonight?
So, I just celebrated my dad's 97th birthday with him and with my mom a couple of weeks ago. And I'm incredibly grateful for the fact that we're able, as a family, to still get together with multiple generations. But unfortunately, that's not the norm for most American families. And as we look at what's happening every year, our intelligence community assures us that there is an October. Now, this is a highly classified piece of information here, but October seems to happen after every September, just about every year. And when October happens, then we start seeing people getting sick with respiratory syncytial virus, or RSV. And after October, there's this thing called November. You may have heard of it. And when November happens, then we get the flu season kicking off. And somewhere along the way, as if that wasn't enough badness, especially for older Americans and for those who are and underinsured, we wind up having a COVID surge on top of all of that. And we wind up with tens of thousands of Americans who die every year of often preventable illnesses because we were not able to reach them and help them understand the value of vaccines or of the therapeutics that we have available. So I reached out to you, Dr. Tuckson, if I may read, and I reached out to you because this breaks my heart. I want every family to have the same experience that my family has, where we can get together across multiple generations year after year and celebrate our family traditions, celebrate our faith traditions, celebrate our time together. But to do that, we've got to find a different way to communicate. And right now, we're still in the middle of the flu season. We've probably got 2 to 3 months to go. We've had at least 10,000 people who have died of flu this year. And my ask to you and my ask to everybody on the line, as you reach out to the communities with whom you're in regular contact, please encourage those in those community groups to get their flu vaccine. That it is not too late to do that if you've not been vaccinated. And we know that there's still 2 to 3 months of this flu season to go. And then the second request that I have is for all of you on the line, how do we do this better next year? odds are good that October is going to happen again in about 10 months, maybe 9, depending on which calendar you look at. But how do we do a better job of partnering with you so that we can reach out to Americans who we historically struggle to reach and provide them the information to help them make the right choice about protecting themselves, their families, their loved ones, their coworkers, the people at church, so that we can cut down the number of folks who die of preventable illnesses and make sure that families can celebrate the holidays or key milestones together.
You know, I'm glad you talked about the flu. That's important because people, I think, don't, again, forget that is a disease that kills so many. But let's make sure we also understand about COVID. People are still dying every week from this disease. Can you give us a sense of the statistics right now so that our audience is clear about the urgency of going after COVID yet again?
Absolutely. So we're looking at around 200 people a day dying of COVID. It's the number
200 a day?
A day, every day. That's the number 10 killer in the United States. So of all of the things that people can die from, this is still in the top 10. And in the older communities, it's even higher than that. And that's, again, the tragedy, the part that breaks my heart as a doctor and as a family member is we know that we can protect people if they will agree to be vaccinated. We know that if they become infected and they're older, or if they have medical problems and they receive Paxlovid or Lagevrio, that we can minimize the risk of them getting seriously ill. We have great data that shows that these are safe and effective vaccines and safe and effective treatments, but we're struggling to get that message out to those who would benefit the most from that information.
Got it.
And I beg you all for your help with this.
Well, thank you so much, Paul, for joining us and for the urgency, and we appreciate it, and we'll be here to work in partnership with you in the days to come. Thanks again for joining us.
Thank you very much, and thanks to everyone on the line tonight.
And now I'm really pleased that Dr. Mandy Cohen is with us. Dr. Cohen is the director of the Centers for Disease Control and Prevention, and also the administrator of the Agency for Toxic Substances and Disease Registry. I also want to bring back my colleague, Deborah Fraser-Howes, together as we will have a chance to engage you, Dr. Cohen, with some conversation. You're very early still in your tenure, but you come well prepared. Can you just give us a quick snapshot of what you consider to be the most important things on your agenda as you now take charge of the Centers for Disease Control?
Well, first, Dr. Tuckson, Dr. Fraser-Howes, wonderful to be on with both of you, two legends in this work that we continue to learn from every day. So thank you for organizing this. And apologies for sort of being on the move, but I didn't want to miss joining this and answering as many questions as we can get through, because it's an important time. We are outside of the COVID emergency, but as you were just talking about, COVID is not gone. And as I took over at the CDC, I'm about 8 months in right now, top of mind for me was to make sure that we were prepared for this fall and winter. And we know foundationally all of the work we want to do to protect health rests on a foundation of trust. And we need to make sure that we are putting out accurate, timely, simple information so that folks can protect themselves. And importantly, if you want to have trust with folks, you have to work with trusted partners. And that's why I'm so grateful for both of your leadership, for the partners that we have had through the COVID emergency. You know, I led the COVID response for the state of North Carolina, and we could not have done that without deep partnerships with the African American community there, with faith leaders. I actually got my vaccine with Reverend Barber, a civil rights leader, right? It was critical for us to do that work together, to build trust, to make sure that we were reaching folks who historically we have not been able to reach as well. And so I take those lessons learned to my work here at the CDC. And so we are going to be response ready for no matter what comes. So as COVID is not gone, we'll continue that work, but we also have to get ready for whatever may come in the future. So we have to make sure we're solidifying those lessons learned that we had through the pandemic, and that's what we're focused on.
I know that in a second I'll bring Deborah in, who wants to talk a little bit more and ask about your plans for community-based engagement. But before we do, let me just quickly have you tell us about the variants now. What are the COVID variants that are circulating? I know that I've been following it, and there's a new one that seems to be gaining traction very quickly. And also, how dangerous is that one, and what should we know about it?
Yes, so important for everyone to understand that this COVID virus continues to change, just like we have seen the flu virus changes every year, which is why we need an updated flu vaccine. The COVID virus is actually changing faster than what we see in terms of change from the flu virus. So that is why we need to continue to stay ahead. And so what we're seeing with this new variant from what you were referring to, the JN1 variant, is that the virus actually is getting more transmissible, meaning easier to spread from person to person. But the good news is we don't see an increase in severity. So we don't see that it's making folks more sick, but it is more catchy. But remember, good news, our vaccines work, our treatments work, our tests pick it up. So we're in a good place. We just need to make sure we're using the tools we know work to protect each other.
Deborah, I think you had a question about testing.
Yes, Dr. Cohen, and thank you again. How do we know, there was a real problem in the very beginning of this pandemic where Black communities were not getting tested. How do we know about the levels of community spread since we're not testing like we did, after that first scare and we got into the pandemic, people started getting tested. We're not doing that anymore. So
yeah, we are. Yeah, well, we are in a different place on a lot of fronts. So the way that we are tracking the disease is different because we are different. And the fact that most of us have either gotten vaccinated or had COVID. So about 97% of us, maybe 98% of us have some underlying immunity. So it does change how we both react to the virus and track it. We are tracking, of course, we still get information from our lab partners. So we do still track laboratory tests, and you can see that on our website. But really, we're looking at a couple of different indicators. We're looking at wastewater, actually. So it helps us without everyone having to swab their own noses. We actually go straight to the wastewater all across the country to know how this virus is spreading. And then we can sequence various samples so we can know if it's changing. So it really helps us. I think this is an innovation that we really put into place during COVID, and we're going to use going forward. So that's one. But then of course, we look at hospitalizations, and of course, we track deaths. But we want to stay ahead, and that wastewater helps us do that.
And on this testing question that Deborah asked, I wonder, should we, keep tests in our homes just as we did before? Does it help us to distinguish between the flu, the RSV, a regular cold? What do you suggest we do? And by the way, some of us have had these tests in our cupboards for a while. Can we still use them?
Well, so we want to make sure that everyone knows you can get 4 free COVID tests right now from covidtest.gov. So if you are low on tests and you want to order your test, go ahead. That would be great. And we do want you to check the expiration date on those. Often the FDA will extend those by another 6 months beyond, but you want to have up-to-date tests, so making sure that you're having the most accurate answer for you. You can get those from CVS, from Walgreens, and of course, free tests at covidtest.gov.
So it's good to know that they still work and that these tests will pick up even the new variant. So
That's
if
right.
you are someone who has reason for concern, either for yourself or because you're going to be around an elderly family member, you're going to be going to church with other folks who may be immunocompromised, and you have symptoms, use the test, get tested, and make sure that you don't inadvertently infect someone else. Is that reasonable advice, doctor?
That's great advice. We don't want to forget about, if you feel sick, it's hard to know, do you have flu? Do you have COVID? Using those tests really help because that can also get you access to treatment, and treatment could save your life. I will say my parents had COVID this season. They're both over 70. When they started feeling sick, I immediately said, get that COVID test out of the cupboard, test yourself. And then they found out it was COVID, and then they could start treatment right away. And I truly think, my parents have some underlying medical issues in addition to their age. I think Paxlovid saved their lives. So you want to make sure that you're testing yourself if you get sick so you can get treatment.
Deborah?
Dr. Cohen, if I haven't been vaccinated recently and got COVID, how soon after recovery should I be vaccinated?
Yeah, 2 months. So if you've had COVID After 2 months, you can get the updated COVID vaccine. And again, we have a new version of the vaccine that came out in the September timeframe. So if you haven't gotten vaccinated since September, still good to get that updated COVID vaccine, because to Dr. Tuckson's point, this virus has changed. You want to make sure you have the most up-to-date version of the vaccine so you are protected. And we're still seeing that those changes circulate right now. So the vaccine is still covering the changes to the virus that we are seeing.
Some people that I've talked with, Dr. Cohen, are a little confused about whether or not we're talking about getting a vaccination or a booster. Before we got our primary series, then we had to get boosted. What's the way in which we need to think about being vaccinated today?
You know, I'm hoping that it honestly doesn't matter as long as you get protected, whether you call it a vaccine or a booster. We want your immune system to be at its best fighting shape so that you can be protected. And again, because we know the virus changes, but remember, not only does this have serious consequences, particularly for folks who are older, we're seeing 1 in 7 people get long COVID. Right. These are extended symptoms of feeling sick. No one wants to be sick to begin with, let alone long symptoms from this virus. And even a mild case can do that. Getting vaccinated reduces your risk of long COVID as well.
We have one of the country's experts on long COVID coming up in the program
Fantastic.
In a few minutes. So thank you for that. Before we get to the last question from Deborah, let me sneak 2 quick ones in. Number one, do masks work or not? We've seen a lot of misinformation in the media over the last few months about masks. Would you please clarify for us masks?
Yeah, or lightning round. Masks work. You want one that's well fitted to your face, and you have to use it. They only work if you use them, and they're well fitting. But masks work.
And by the way, I think it's pretty clear that if you are someone with an immunocompromising illness or around someone who is that way, do you recommend today that people wear them when they're out about in public transportation or in the mall or a grocery store?
Well, the things you want to think about, what is your health status, right? So if you are someone who is at higher risk, right, you're fighting off cancer, you're older age, then you want to protect yourself. You want to know how much virus is circulating in your community. Those are things that you can find on the CDC website. And you want to know what kinds of activities are you doing? Is it something where you're going to be exposed? And then if you are someone who may go visit someone who is at higher risk, or say you work in a setting like a nursing home where you're working with folks who are more vulnerable, those are the kinds of times where you might want to take extra precautions. I certainly do that. Again, back to my parents, ahead of going to visit my parents, right? That's when I take higher levels of precaution because I know I'm going to see them and I don't want to bring anything to them.
Good. Deborah?
Dr. Cohen, we're concerned about what we're hearing about measles, polio, syphilis, all of these things that are on the rise. What do you recommend that we do to get that information out to our communities and have our communities protect themselves there?
Well, it's really important that we keep vaccinating our kids. The good news is more than 90% of our kids are still vaccinated, and that is great, and we need to continue that. The measles that we are seeing of recent are in folks that are unvaccinated. Measles we've almost forgotten how serious measles can be for folks, but we were seeing so many children in particular dying of measles. So we need to make sure that we are having conversations with your pediatrician about getting vaccinated and keeping that up.
Well, as we close out with you, Dr. Cohen, both Deborah and I are particularly pleased that your introductory comments mentioned the importance of community-based organizations, and you have been a great supporter of our community-based efforts. I know that we can count on you in the future. You have seen by just the number of organizations on our flyer from the Black community who are here and present. So that ought to make it pretty clear that our community takes this seriously and we're prepared to act. As we close out, and I just want to, again, a lightning round question, but several of us noticed on the news today an article that seemed to suggest that CDC plans to drop the 5-day COVID isolation guidelines. We're now, all of us in the audience are like right at the moment now that we'll get the actual facts on this late breaking news story. Does the CDC plan to drop the 5-day COVID isolation guidelines?
Well, look, nothing official to announce today. But look, I wouldn't be doing my job if we weren't always looking at the science and the evidence and thinking about what should our guidance be. Nothing official is changing right now. Again, our best advice to you: get vaccinated, get tested, get treatment. Right, and that is not changing. Those are the ways we protect ourselves. Stay tuned as again we're at the tail end of a season. We're looking at that data to understand what happened through the season. What are the things we learned over the last number of months, and does that have any impact on our guidance? So stay tuned as we look at that data. But again, what's not going to change? Getting vaccinated to protect ourselves, getting tested so you know what you have so you can get treatment. So those are the things to focus on. And wear the mask when it's appropriate. Thank you.
Dr. Cohen, thank you so much for taking the time.
Thank you so much, Dr. Cohen.
Okay. Thank you so much. Appreciate the partnership.
All right. Let me bring in now Dr. Namajay Bumpus, who is really a great friend. She is the new Principal Deputy Commissioner at the Food and Drug Administration, the FDA. And joining me in the interview is also our very good friend, Dr. Valerie Montgomery Rice, President, CEO of the Morehouse School of Medicine. Welcome, Dr. Bumpus. And let me just start right out, because you have been chosen for this position because you are a nationally recognized expert in your field. Your credentials are impeccable, and you are well respected by your peers. You are also dedicated to the health of all the people in this nation. And so I think it's important that people of color know that we have physicians and scientists such as you in these leadership positions. What are your responsibilities and your role there as the principal deputy of the FDA?
Thank you for that, and thank you for having me. So I am a scientist. Before I came to FDA, I was in academia for about 12 years, running a research laboratory, and I'm a leader in an academic medical center. And I was really happy to come to FDA as first the chief scientist, and now I've transitioned to principal deputy commissioner. And so a key part of my role really is to focus on the way that we work internally to make sure that we have the processes that we need to have in place, that we're augmenting our culture of collaboration. But I also want to ensure that we're leveraging science fully in our decision making. So that means, even though I'm no longer chief scientist and I'm in this new role, but continuing to empower our scientists. People may not know we are a science-based agency. We have people who do science as their primary role at FDA. So that I'm empowering those people, that we're continuing to leverage all of the knowledge that they generate, leverage the best information that's out there in the world from our partner agencies, from other folks in the biomedical ecosystem, the public health ecosystem, and that we're able to take all of that and move things forward. And as you said, really make sure that our work is serving all people. That's crucial.
Thank you, Valerie.
Thank you, Dr. Bumpus, and congratulations on your role. Thank you for showing us what great scientists look like and what's possible with a long career. We really appreciate that. We just heard from Dr. Cohen about the new variants, and this new variant that popped up sometime around, I guess, September or so. And we also know that we have some current boosters or vaccines that do appear to cover that. Can you give us a little background about what we should expect as we move forward? Should we continue to see different variants? And will these vaccines that we currently have in place cover those variants?
Yes, so the latest COVID-19 vaccines approved and authorized in the fall were formulated to more closely target the most prevalent variants and to provide better protection because of that against COVID-19, including severe COVID-19. So receiving the updated COVID-19 vaccine can restore protection against disease that has waned over time. So as we just heard, there's emerging evidence that indicates that the current COVID-19 vaccines are protective and remain protective against serious consequences of COVID-19 for the currently circulating strains. And viruses, including SARS-CoV-2, which is the virus that causes COVID-19, may change over time. And most of these changes can have little to no impact on viruses' properties, but they can have an effect. And how these changes impact the virus could be related to how easily they might spread, or severity of disease, or even performance of vaccines. But again, with that in mind and with that knowledge, the vaccines that are, that have been authorized and approved in the fall were really designed to target those most prevalent variants. And I'll say that, FDA, we have advisory committees that help guide our decision making around this, and that together with our vaccine advisory committee, which has diverse membership, we publicly review available data on the most prevalent variants that are circulating and the most recent vaccines' effectiveness against them. So this is something that we'll have to continue to monitor. We'll continue to monitor emerging variants and assess the need for updated vaccines. But at this time at FDA, we anticipate that the composition of COVID-19 vaccines may need to be updated annually, as is done for seasonal flu vaccines.
That's an
Thank you
important
for
point.
adding that. Excuse me. Thank you for adding that part, because I was going to ask, how long does the current vaccine, if I got my booster in September 2023, like I was supposed to because of the new variant, it's been now almost 6 months or so, I guess. So what should I be expecting?
I think, keep watching out for guidance, but what we anticipate is annual, and that we will, in the fall be, as we did this fall, kind of rolling out what the vaccines at that time will be that we're approving and authorizing.
So it's starting to look a lot like flu, isn't it? Right. Yeah, the same thing. One of the things that we confronted so often in our town halls during the pandemic was the rumors, the misinformation, the deliberate disinformation about the safety of these vaccines. You're going to grow a third ear, and it's going to find its way into the DNA of our cells. All kinds of crazy things were promulgated, all in an attempt to try to get the Black community to not take advantage of these life-saving vaccines. Tell us what actually happened. As you're sitting there in the center of power at the FDA, did we observe any of these horrible things that people kept predicting?
I would say we're at the center of definitely the scientific data. We're looking at all of it, and that's what we're making our decisions based on. And, I would say really the truth is the type of events that you're mentioning or that people are really talking about, and some of what we're hearing don't occur and honestly aren't possible side effects of the vaccines. And I think there's still, people having some misunderstanding in addition to misinformation just about vaccines and what they are. And I think not fully recognizing the major public health impact that vaccines have had and just how many lives they've saved. So the bottom line is that the benefit risk profile of the authorized and approved mRNA COVID-19 vaccines is well understood. These vaccines have been administered at this point to hundreds of millions of people in the United States, and we know a lot about their profiles, and we know that these things aren't occurring. We also understand the science of them just from knowledge of biology and biochemistry and the studies that have been done on these vaccines in laboratory settings as well. And I would say, given the dramatic reduction in the risk of death and hospitalization and the serious side effects that is afforded by these vaccines, lower vaccine uptake is going to and is contributing to continued death and serious illness toll that COVID-19 is taking. As we heard, there still are people dying from COVID-19. Lower vaccine uptake contributes to that. And certainly misinformation can be a reason why there's lower vaccine uptake. So it's really important to address that. And I just want to remind people again, we're a science-based agency. We are evaluating data all the time. And the data that we've evaluated, we have determined that COVID-19 vaccines meet our rigorous standards for safety, effectiveness, and manufacturing quality.
I sure wish some of those people that promulgated all those terrible rumors and tried to get us to kill our own selves, I sure wish they would come forward now and apologize and say, hey, listen, I'm sorry. And by the way, I'm now going to lead the effort to get more people vaccinated. At the end of the day, let us make no mistake about it. The fact that the Black community was able to get itself vaccinated at the rates that it did saved hundreds of thousands of lives. And that is important for us to remember. Let me turn to Dr. Montgomery Rice for the last question of you, Dr. Bumpus.
Dr. Bumpus, as an OBGYN, I want to shift gears a little bit. I know we talked a lot about COVID vaccines and flu vaccines during pregnancy, but now we have an RSV vaccine. And the RSV virus is real. It affects adults, it affects children. Should we be encouraging more women and seniors to get the RSV vaccine?
Yeah, so the two new RSV vaccines are safe and effective. We have data on that. Again, they're safe and effective, and they're indicated for older adults age 60 plus. And one of the vaccines is indicated for pregnant women to prevent disease caused by RSV in infants, and there's an approved drug that prevents disease in infants and children up to 24 months in age. So CDC has noted that flu, COVID-19, and RSV vaccines may be given at the same visit. And for eligible patients, this means that they can make one trip to get their fall and winter vaccines, and they can get all of these vaccines at the same visit. And they should certainly people should talk to their healthcare provider about that option, but they can, based on this, be given at the same visit. And if folks do prefer, they talk to the healthcare provider, they prefer to receive each vaccine at a separate visit, then according to CDC, there's no minimum waiting period between vaccines. And so these are vaccines that are safe, effective. As we talked about, vaccines work and are among the safest and most effective public health measures ever introduced. And they're directly responsible for reducing suffering and saving innumerable lives around the world. So we need to get these vaccines. And in the case of the three we were just talking about, flu, COVID-19, and RSV, they can be received at the same visit for eligible patients.
Well, thank you so much, Dr. Bumpus. Robin Wilkes in our audience is asking, by the way, is the updated vaccine a one-dose vaccine?
So we have on our website, COVID-19, COVID-19 vaccines, you can see the various vaccines that are there. But, people, I would say, yes, get a dose of the vaccine. And then we will continue to give people guidance about timing for getting any additional vaccines, probably annually. But I would say the best thing to do is really check out our website and look at all of the vaccine options.
And there you'll see that there are two different kinds of vaccines for COVID. And so you'll see two different formulations made by different of the companies that make them. All of them are effective and all of them work very well. And above all, as you have emphasized today, let's make no mistake about it, they are also safe. And you're looking at the data. We have a person of color in the room looking at the data, reporting back to us. And so let's have confidence that we have our people there trained well and is giving us the facts. Thanks so much, Dr. Bumpus. We very much appreciate you.
Thank you.
And now we're very pleased to bring in Dr. Ian Simon. Dr. Simon is the director of the Office of Long COVID Research and Practice at the Department of Health and Human Services. Dr. Simon will also be interviewed also by our friend Dr. Langier as well. So Willis, thank you so much. And I think you may have the first question I think that you wanted to ask Dr. Simon.
Yes, I do. Dr. Simon, first of all, thank you for the great work that you're doing. Many of us have heard about long-term COVID, but we really don't understand it. And for those of us who do, we need you to help us understand what is long-term COVID and kind of put it into perspective for us.
Yeah, sure. Well, first of all, thank you for having me here. It's been a wonderful event so far, and so happy to be here with you. So as we all know, most people that contract COVID-19, they get sick. Some maybe don't have severe symptoms, but there's recovery, and a lot of people recover completely. They recover quickly. Some people, though, continue to experience new, persistent, or recurring symptoms or conditions for weeks, months, even years after that initial infection. That's what we call long COVID. So the other important thing to know is that long COVID is not just one thing. What we've seen, just like the symptoms that can occur with the initial infection, long COVID is an assortment of symptoms and conditions that sometimes overlap, sometimes resolve over time, sometimes emerge after the initial infection. It can show up as chest pain or lung damage, shortness of breath. Sometimes it can show up in terms of difficulty thinking or concentrating, what we commonly know as brain fog. And that can be either alone or combined with headaches. Some people actually experience debilitating fatigue to the point where it's hard to stand for more than a few minutes at a time, or physical exercise is nearly impossible. But what we also understand is that it's likely caused by different biological mechanisms, and different risk factors can lead to these range of symptoms. But also previously healthy adults, even with those without the typical risk factors we think of as comorbidities for COVID-19, they can also develop long COVID. Right now, the CDC has data that shows that about 3 to 6% of adults currently today are living with long COVID, and that 25% of them have significant activity limitations. We also know that children, while less likely to experience long COVID, can also have long COVID with many of the same symptoms.
So these symptoms are important, but before I ask that, one of the people in our chat, I just noticed, had a question about the vaccine and any concerns around heart problems if you already have pre-existing heart disease. I think Dr. Bumpus may have left the studio, but if she has, if Dr. Hanfling from the White House office, if you would have the opportunity to respond in the chat to that question, we would appreciate it. Anything that you want to say to our viewer who is interested in any issues with heart and vaccine. And so we'll all be able to learn. If you could see if you could take a moment in a few minutes and put that up there. You mentioned this a wide range of symptoms, Dr. Simon. So how do you know? I mean, if you're walking around and you feel just a little tired and you say, I must have long COVID, or if I have a sense that my brain isn't sharp today as it used to be, maybe I've got, that COVID fog. How do you know?
Yeah. It's a great question. I mean, right now, I wish there was a simple diagnostic test where you can go to a doctor, get a blood test, and they can tell you you've got long COVID. But unfortunately, we are not there yet. So what we do have, though, is we do have medical professionals who are right now working to understand long COVID, to define long COVID. And so if you think you might have it, the best course of action is to go to a doctor, is to get them to run the test, to do what they need to do in terms of understanding, chest X-ray and CTs and all that. And what you'll find then is that they will be able to take a look at the range of symptoms, the ability to speak with you as the patient to understand what you've been experiencing in terms of COVID infection and symptoms since then. And that's really how you get to that point is by going to the medical professionals.
Willis?
Yeah, well, I wanted to ask you, as a part of the health professional community, as a biomedical scientist, I'm curious to know, well, first and foremost, what are the causes of long COVID? I mean, what have we learned about this?
Mm-hmm. Yes, and I'm also a biomedical scientist from the Richmond, Virginia area. So great to see another Richmond native. So right now, we don't know definitively what causes long COVID. There are several proposed explanations that are currently under investigation from researchers all around the world. One proposed explanation is that there may be fragments of the SARS-CoV-2 virus that persist in the body. Maybe it reactivates or maybe just causes the symptoms to reappear. Another possible cause is that maybe the original infection might have caused your immune system to go on overdrive, especially if you had a more severe case, causing high levels of inflammation in the body, which might have damaged tissues. Another possibility is that maybe the initial infection triggered autoimmunity, where your own immune system is making antibodies that will attack your organs and your tissues. Each of these mechanisms are under investigation. Each actually have some preliminary evidence from some small studies, a couple of large studies, but nothing definitive yet.
So do we have any information on what to do if you have it?
Yeah, what you should do is see a doctor as soon as you can. What you can do is there are a number of emerging sort of emerging perspectives on how to treat some of these symptoms. Many of these have been tried with other groups that have infection-associated chronic conditions such as chronic fatigue syndrome, long Lyme disease. And so there are lessons that have been learned from those communities that are now making its way into treatment of long COVID. So it's really about getting to a doctor and urging them to learn about long COVID if they are not familiar. The CDC has a great list of tips for not only for patients, but also for doctors who are trying to understand.
Well, listen, I was so glad that you are in that office and that we've got a physician of color who is responsible for one of the most important issues in America today. And I'm glad that you're doing the research, finding out the facts, and then can communicate it to us. But I would imagine that the last word we would have with you is the most important thing to know about long COVID is don't get it.
That's right. The best way to prevent long COVID is to prevent getting COVID, and that's through vaccination. That's through wearing your masks and doing all the preventive measures that we need to be doing. That Dr. Cohen and Dr. Bumpus articulated here tonight.
Well, thank you so much, Dr. Simon. We appreciate it. And now we turn to a conversation with and for Black women. We are joined now again with Dr. Valerie Montgomery Rice, Virginia Harris, and Deborah Fraser Howes. And they are really here to have a conversation with Dr. Valerie Montgomery Rice about some of the issues that are of importance to Black women. And let me start out with you, President Harris.
Thank you. Dr. Montgomery Rice, it is so nice to see you again. And I am so proud of your commitment for fostering a culture of informed decision-making and proactive healthcare advocates to all of our communities. My first question for you is, how do you view COVID prevention within the overall context of protecting women's health?
So first of all, thank you for the question. So I view it as one of our responsibilities to ourselves. When we think about COVID-19 and the impact that it had on women and the things that we do as women, remember this, 2 out of every 3 caregivers in the United States is a woman. 70% of all the jobs in the country that really deal with contact of direct with people are held by women. Women are responsible for taking care of their families, taking care of their extended family, and of course, taking care of themselves. When we see people with chronic diseases and chronic illnesses, there's a disproportionate number of people who are women who are taking care of those people. We also know that when we looked at what happened during the pandemic, we saw that women were disproportionately impacted, particularly women of lower socioeconomic status, because they could not, be at home and work from home, etc. And they were the ones who were also mostly burdened with taking care of the children who were at home from school. All of this led to increased stress. It caused us to delay our self-care, our annual mammograms, our annual GYN exams, our annual osteoporosis testing. So for me, when I saw a vaccine become available, I was so excited because I thought that it gave us permission once again to take care of ourselves and to relieve ourselves of the unnecessary burdens that have been placed on us just because of the roles that we play as women. So I believe that in order to really address our overall health, we must continue to be vaccinated, be up to date with our vaccines, and also remember that if you don't take care of yourself first, you're not going to be able to take care of others.
Thank you so much, Dr. Rice. You know that you're one of my heroes, have been for a long time, so there's no question about that. I have a question for you that's really in your wheelhouse as OBGYN. We've seen a significant increase in the number of Black pregnant women dying, and it is frightening to the community. It's referred to as maternal mortality rate. What special precautions should pregnant women take with COVID? Should they get vaccinated? I think Dr. Bumpus just mentioned that there was a vaccine for pregnant women. Are all of these things safe with the perilous situation that these pregnant women find themselves in now?
So the CDC recommends that everyone greater than 6 months gets pregnant. I mean, gets a COVID vaccine, and that not get pregnant, but get COVID vaccine.
Yes,
And
please.
that includes pregnant women. So yes, so I think we should remove any doubt that pregnant women should get the COVID-19 vaccine. And why is that? Because when Black women and pregnant women got COVID, and particularly Black women who got COVID, they had higher rates of ICU admissions, they had higher rates of severe respiratory disease, and they had higher rates of death.
Yeah.
And so we know that we were sicker when we were pregnant and got COVID. And one way to prevent that is with the vaccine. So I really want to stress to pregnant women that even before you think about getting pregnant, part of your preconceptual counseling ought to be, am I up to date on my vaccines, right? Is COVID-1, am I up to date on my latest booster? Such that if you do get COVID during pregnancy, you also should know that you can take Paxlovid if your symptoms are moderate to severe. And also if you get COVID, even if you've been vaccinated, you get COVID and you're pregnant and you deliver, the chances of your baby being sick are very, very low. And also you can continue to breastfeed. And so we really want to make sure that women go to the CDC website. They have really good information that is very, very clear about what are the things that you can and cannot do, or should and should not do, or should and should know about COVID during pregnancy.
Virginia, do you have one quick question and one quick answer before we close this section?
I do. Dr. Rice, my friends and I are a bit confused as to how we weigh the risks and benefits of some of the COVID prevention guidance now that the official pandemic is over. There is a lot of uncertainty.
Well, so first of all, we are mildly out of what I would call the pandemic stage, because we continue to see surges of the COVID-19 virus, okay, particularly in people who are unvaccinated. And it's clear that people who are unvaccinated have the higher risk of complications. But that doesn't mean that you cannot get COVID even if you are vaccinated. And so common sense things, if you are symptomatic, put on a mask. You put on that mask to protect others. And I think Dr. Cohen talked about it, getting a mask that fits your face such that you can actually prevent the spread of the virus. If you are going to be around elderly people and you know that you have had symptoms, etc., even if your COVID test was negative, because you also could have RSV and other things, wear a mask. So common things, hand washing still is very, very important. And then monitoring yourself for symptoms, and then testing. We still have tests that will detect even these new variants. So if a test is positive, you heard Dr. Cohen said we still are saying isolate for 5 days. That hasn't changed. And if you have moderate to severe symptoms, please check with your provider and take Paxlovid, because one of the things it does decrease the symptomology and people have less severe course. So really common sense things that we know work: washing our hands, sanitizing, and then wearing masks, particularly if we are symptomatic, and caring for others. And protecting others from ourselves, particularly when we have symptoms.
Well, ladies, thank you, our sisters, for a very enlightening conversation. We appreciate it. And now it's time for our brothers to take center stage. And we're pleased to be joined by one of the great warriors in the COVID fight, and that's Dr. Stephen Thomas, the director of the Maryland Center for Health Equity in the School of Public Health at the University of Maryland. And we're bringing back with us also Dr. Lanzier and Dr. Simon. By the way, Dr. Simon, 10 seconds, real quick. Delinda in the chat wants to know, is there clinical trials going on for long COVID? Yes or no? And what, and how, if yes, how do we access those?
Oh, yes. So the NIH has a large initiative called the Recover Initiative. It is a large-scale set of clinical trials for long COVID and the symptoms of long COVID. You can go to, I believe it's recover.org, or you can also find information on that at, let me pull up the website, covid.gov long COVID and can direct you there as well.
So either I think Dr. Renee or someone in the back there might be able to say that, put that in the chat again so that everybody will see it. But if not, Ian, maybe while the conversation is going on, you could also put it in the chat. With that, let me turn to Willis for the first question of Dr. Thomas. Oh, Will, you're still on mute, sir.
I'm a little too efficient with my mute button, but that's always saved me professionally. But let me just say, Dr. Thomas, first and foremost, thank you for the work that you are doing. And I really want to get us going by understanding, how do you view COVID prevention within the overall context of protecting men's health?
Well, I'm coming to you from the front lines of the pandemic, and a recognition that there is a silver lining. And that silver lining is reflected on what we're doing here tonight. Reed, first, thank you, because it was on this show that we launched Shots at the Shop, where the President of the United States announced a campaign mobilizing Black barbershops and salons all across this country. Thousands of them were trained. And you know what happened when we went in there, my friends? They said, are you going to give us the jab and leave us with the cancer? Are you going to give us the jab and leave us with the diabetes? And we told them no. So the overall approach, Dr. Lorenzer, is we must address those health disparities that were there before the pandemic. And who would have imagined that it was the private sector, the small businesses of the Black community, the barbershops and the beauty salons that stepped forward? They now are being trained as lifestyle coaches. They're certified community health workers. But I would be remiss if I didn't give you a message right from the shops. They're feeling a little neglected.
Mm-hmm.
You know, a lot of the clinical partners aren't coming out anymore. The grant's over. So once you have trust, you must be trustworthy. And so I think we're at a critical moment right now of losing these spaces where social norms are set. A lot was discussed here in this show. You want it amplified in the Black barbershops and beauty salons. And that's what the campaign HAIR is all about. Health advocates in reach and research. And they're listening to you right now, all across the country. What message should we be talking about in the Black barbershops and salons, and Black men in particular?
Reed, may I do a follow-up very quickly? How do you curb the reluctance? I mean, I still go to the barbershop for what I can get out of it. But I say, when I have a conversation with my barber or with gentlemen in the barbershop, there is just such a huge gap of education. How are you making that gap close and curbing the issue?
Well, you see, I changed my background. So we have to be flexible. We have to come into the community and meet them where they are. And you have to understand that, Black folk, I have to tell my white friends, it doesn't matter how much hair you have when you go to a Black barbershop. And all you brothers know, you're going to be there half a day. But my white friends go to places where it's very transactional. They never even they don't even know the person's name, some of them. But the unique cultural experience of the Black barbershop and salon, not unlike the church, is a sacred space. And Reed, you know what we've discovered? These are our intelligence officers. These are the folks we should be listening to about what it means to get vaccinated, what people are thinking about getting and wearing a mask. And so they feel right now they went the extra mile to get Black people vaccinated so white people don't suffer, because that's what it feels like. We got to stay on the front lines, and the barbershops and salons are stable infrastructure for us to bring our message.
Great. Ian, what's on your mind on this conversation?
When I think about this in the overall context, it makes me think of a couple of things. So one, what it's like to be a father and a husband at this time, where I'm worrying about my family's health. I'm worrying about making sure that we get through the winter season with all the different colds, make sure they're happy, my kids are happy and healthy, and making sure that they're prioritized. But at the same time, I've got to make sure that, I'm going to be around to take care of them. And that, for me, is not only, getting vaccinated to prevent the fact that I'm going to get COVID, but also all of those other persistent conditions that come with long COVID, that heart trouble, kidney trouble. A year ago, last year's respiratory virus season, my mother contracted COVID-19. She was already dealing with a history of hypertension, high blood pressure, and the like, and ended up with severe kidney disease to the point where she's now on dialysis. So it can hit you. It can be one of these things that seems innocuous at first, but can knock you for a little bit, especially if you're dealing with other conditions. So it's about protecting your family, your loved ones, protecting yourself, making sure that you're around, that we're around the long term.
Before we ask Stephen the final question, I do want to ask Dr. Hanfling again. You have done an excellent job in the background in the studio, Dan, responding to some of these questions in the chat. There's one in particular about someone who has MS and whether or not they should take the vaccine. If you would have an opportunity to respond in any way you see fit to that very excellent question, we would appreciate it. Dr. Thomas, as we close out for Black men, as you look in the camera at the brothers that are out there, what do you say to them about sort of overcoming this reluctance that so many of us have? And I know that you mentioned to me the other day that you're starting to see paid agents being sent into the barbershop to foment misinformation and distrust.
That absolutely, again, it's the wellspring of where the social norms are set. And so I think that we have to be there. We have to listen. We can't go in wagging fingers. You have to understand, we got people who showed up to our events hesitant, Dr. Tuckson, and they left hesitant, but vaccinated. We didn't have to change their worldview. When you came to our events, it didn't feel like you were coming to a hospital. You were coming to a community family reunion. So Dr. Simon, you're absolutely right. Maybe I won't do it for myself, but I'll do it for my daughter or my loved ones. We get that message through. That's how we save our community. And that's the message from Booker T. Washington to Frederick Douglass. We're going to have to do this ourselves. So thank you, Reed, for keeping the door open, banging on the door, because in order to get to trust, we must first walk through truth. That's Abigail Echo Hawk's quote, a Native American sister who joined me and others at the White House about what works. So if these things work, why would we abandon them? That's the message.
Oh, outstanding. Well, thank you so much for joining us. And now as we start to wrap up and close our sessions, we have a couple of, all of our remaining guests can certainly come back into the studio. And Dr. Hanfling, I think you're there with us as well. One of the things that we have been asked in the chat is about the shingles vaccine. Does any of our health professionals want to comment on the importance of getting the shingles vaccine? And I will start that out by saying it is very important. And the one thing that you do not want from the patients that I have treated and had is this terrible consequence of having chicken pox when you were a young child. And that virus stays in your nerve system and for whatever reason decides to open itself up and come back out. And what you get is pain that is unimaginable, especially as just even your shirt brushing across your chest can be so painful. The shingles vaccine is one that works very, very well. And I think it is certainly, again, been around a good while. There's some new formulations of it. In fact, they've even improved it. I see you shaking your head, Dr. Alonso.
Yes, as a person that it's been administered to personally, I definitely advocate for that because to your point, the whole intent of vaccination is to dampen the potential if you are exposed. And I think that has been really the conversation that I have been leading, even as the general president of Alpha Phi Alpha fraternity. and talking and leading our organization through the pandemic and really elevating or helping to elevate along with other members of our organization the importance of health and men's health, but also for all of us. And I think the Panhellenic Council and the presidents have been extremely supportive, even through transitions in leadership and continuity, and making sure that we approach health as an important factor. And certainly shingles is nothing to really sneeze at lightly. You should take it very seriously, and it's helpful for you.
I would just add, Dr. Tuckson, if I might, that I believe the number's like 1 in 3 will get shingles. And if you're over the age of 50, there's no reason for you not to get a shingles vaccine, particularly if you've had the chicken pox. And most of us have had the chicken pox, even if you didn't have any symptoms. Okay, so we want to make sure that we recognize that vaccines are part of our preventive health strategy, particularly as you age. And particularly as you age, one of the things that happens is your immune system can become dampened. I will put it that way. It slows down, it dampens, and it can't fight off things as much. And so you sort of kind of release a tiger out of a cage when you get shingles, and you can avoid it with the vaccine.
Well, Stephen, I'm going to ask you to turn you 1 second, Stephen, 1 second. I just want to let Dr. Hanfling know I have a question for him, and then I want to alert our 4 welcomers that we're going to ask you for 30 seconds of just your last word in terms of what you got out of tonight. So just make sure that you are prepared for that. Stephen, and then I'm going to come to you, Dan. I have a question for you. Stephen?
Well, this show tonight is like a masterclass for our community. And I want the physicians out there to know that you have a friend in the barbershops and salons, especially those who have been trained. And Deborah knows exactly what I'm talking about. Hyperlocal works. Some of these early symptoms will be seen by the barber or stylers. From hair loss to skin lesions and other things, we can help them stay in their lane and reinforce your preventive message. So important that we recognize the role they can play.
Thank you for that. Dr. Hanfling, there is a question and a commenter that wants to sort of know more about what the government is doing around misinformation and disinformation. I know that a major issue in the White House office in which you serve, is concerned about that. But just can you give us a sense of how you are approaching this very important topic?
Yes, thank you, Dr. Tuckson, and also thank you to all the panelists. I've learned as much, I think, as all the folks who I've been trying to answer in the chat here. So fabulous information this evening. So misinformation and disinformation is a topic that comes up repeatedly, and we are, really digging in to try to understand what steps we can promote to, bring the conversation back to the right side, if you will. And understand that we really have to focus on enhancing trust, believability, explainability, and recognize that where there is disinformation and misinformation, to call it out as such. So these are not easy tasks, but I assure you that across many offices in the White House, this is top of mind right now, including ours focused on pandemics.
Thank you for that. And I think, again, the presence of the 4 top people that we needed to have demonstrates, I think, the how seriously the people in leadership positions are taking the African-American community and working with us collaboratively as we try to save our own lives. Well, this has been a very fascinating show, and I want to thank every one of you who participated. But I want to close out with the last comments from our welcomers, the people who really helped us to make this show happen. And I just want to thank every one of you all for engaging your members. There are literally millions of people who are aware of this town hall because of your leadership. And I want the audience to also know that it did not take any effort other than one phone call to each of these wonderful people for them to bring their organizations to the table with African-American health professionals to provide our community with this information. Let me start with you, Willis.
Thank you so much, Reed. I'll just say that tonight was a catalytic moment for the Black community and for the broader community as we are elevating the education around COVID-19 and the seriousness of even with measles and this resurgence of measles and polio. I think that we have to take it seriously, and we recognize our station as the Panhellenic Council and the National Panhellenic Council in being a broadcaster of good information and making sure that people can trust it we're saying is important and that they should heed it, and we'll move forward as a greater community because of it. Thank you for the opportunity and your leadership in this area.
Thank you so much. Mary Clark.
Thank you so much. This has been very exciting. And it also reminds me that in collaboration is so important for us. I think about Black Women's Agenda and our 15 collaborating organizations. We have an opportunity to put this back on the agenda because I think that there's an opportunity also for us to bring these messages to the community like we did before. I think we have an obligation to do that because so many of our members of our community don't realize that COVID is still with us, that we still need to wear the mask, that we still need to get the vaccines. And also, I think it's very exciting also to hear about the study that's going on at NIH as it relates to long COVID. That information also needs to be communicated to our community. Thank you so much for providing this opportunity for our community. It's been excellent, and I'm pretty sure that we learned more than 3 things tonight that we didn't know before. Thank you.
Thank you so much. Virginia Harris.
Thank you so much. I do believe that there is still a lot of work for us to do as community organizations across the board. There is still a lot of misinformation that we need to continue to spread the accurate information to our audience, the people we serve. And I learned some things tonight that I thought that I knew, but I did not realize that we're still losing 200 people dying from COVID a day. So there is still lots of work to be done, and I'm looking forward to join forces to make sure that we provide information that can help people save lives.
Thank you so much. Deborah.
Brother Reed, you have had another mountaintop moment. Thank you for taking all of us to the mountaintop with you. We know that we're going to be all right as long as we have leaders like you and the other leaders that were here on this program today. I want to say that the Black church, the Black barbershops, beauty parlors, the Divine Nine, the Black doctors, we know what works. We know what works, and we have to let everybody know that we know what works, and we have to get it done. We can no longer say, oh, it's okay that you with us today and leave us tomorrow and then come back to us when there's another emergency. We know what works, and we have to get it done. Thank you for inviting me to the mountaintop with you, my brother.
Well, thank you so much. And I also obviously want to thank Dr. Friedrichs, Dr. Cohen, Dr. Bumpus, Dr. Simon, and also Dan Hanfling. Thank you so much. And then, of course, what do we say to Valerie and to Stephen? Thank you again. Moderna, Novavax, and Pfizer, thank you for your sponsorship. And Dr. Renee and the whole BlackDoctor.org team, BDO team, you guys are terrific as always, and it's great to work with you. As we close out and say thank you to all, let's just keep in mind that we proved during the pandemic that by working together at scale with our organized Black community in partnership with our Black health professionals, we can make a difference. For the first time in history, we closed a health disparities gap when it comes, and that was demonstrated when we had our first primary series of COVID vaccines. We closed that gap, and the Black community was much more motivated to wear masks and to do all the preventive things that we knew we were to do. What was the result of that? Black life expectancy decreased less than even white America in the second year of the pandemic. That shows us that we can, working together, we can save our lives despite the obstacles that we have to carry as we do it. Let's all take care of ourselves. Let's fight for the health of our families, and let us all be attentive to fighting for the health of our community. Take care, and we will see you next time.